Good day, Dr. Romero. I am Nina Nikki Luis Ernie from BSN1 A20. Today, I'm going to demonstrate in assessing the skin or the integumentary system. First is to ask um, the identity of your patient and introduce yourself. Good day, sir. I am Nina Nikki Luis Ernie from Southwestern University, FEDMA, and I'm going to be the student nurse responsible for you today. Can I ask for your name and birthday, please?
My name is John Britt C. Caballero. I am born July 24, 2007.
Okay. So the way you ask for your patient's identity is to ask them the two patient identifiers, which are their name and their birthday. So before we move on, um, we will explain to them the procedure. So, sir, the purpose of this skin assessment is to check for any casual changes on your skin. Do you have any questions for me, sir?
No.
Okay. So, before that, we should do hand hygiene to prevent the spread of microorganisms and the safety of our patient. Now, we ask for consent to our patient that this skin assessment requires on touching them. Sir, is it okay if I'm going to touch you?
Yes.
Okay. So, upon the skin assessment, we should first check the overall skin coloration of our patient for any discoloration on their skin, such as jaundice, cyanosis, pallor, or erythema. Upon checking the patient's skin coloration, I have noted that they have no discoloration on their skin and it is evenly distributed. Now, we're going to check the patient's skin, or we're going to inspect the patient's vascularity and bleeding and bruising. This is to check for their circulation and their signs of trauma. So, there are no bruising, ecchymosis, or active bleeding noted. And their vascular pattern is normal. Now, we're also going to check any lesions on the patient's skin, such as bruises, scratches, cuts, insect bites, and wounds. So now, I'm going to visually scan opened areas, exposed areas of our patient's skin, noting any lesions size, shape, color, and exudates and the distribution and or pattern. So, after I've checked our patient for any lesions, I have noted that the patient's skin is evenly distributed, and it is free of lesions. Now, we're going to palpate the skin using the back of our hands to check if our patient has hyperthermia or hypothermia. So we use the back of our hands um, because it is sensitive, and this is also used for skin temperature. Now, we we will also use gloves when assessing any open areas of the patient. And we will also check the patient for the we were also gonna palpate the patient's skin for moisture and texture, because excessive moisture can often lead to intense sweating, and dry texture of the patient can often indicate that the patient is dehydrated. Now, after I've checked the patient's skin, it is firm and um, uh, normal moisture. So now, um, I'm going to um, I'm going to assess for skin turgor to check the hydration status of my patient by gently pinching under the below the clavicle. So, yeah. So, if the after gently pinching, if it does not revert back to normal after 3 seconds, the patient um, has possible dehydration. And if it does revert back to normal um, before 3 seconds, the patient is hydrated. Now, we're also going to check for edema. So edema is a a build-up fluid that is commonly found in the lower extremities, and the characteristics of it is swelling, taut, and with taut and shiny skin. So now I'm going to check for edema of our patient. So we're going to palpate the patient's skin for 5 seconds and let go. If the patient's skin reverts back to normal, it means that the patient, so if the patient, the skin of the patient does not revert back to normal, it means that the patient has possible pitting edema. And I have not noted that on our patient here. Next is to to also check any lesions of the legs, and we're going to use gloves if there is any open areas or pustules in it. Now, next is we're going to inspect the nail angle, noting if any clubbing is present, as well as the shape or the color of the nails. So next is we're going to palpate the nail for texture and their capillary refill time. So the way we see our capillary refill time is, now we will check the nails of our patient, and we will palpate their nails for 5 seconds, and if underneath it is now pale or white, we then let go, and if it does not, revert back to normal to red or pinkish, the patient might indicate that they have possible pallor or cyanosis. Now we're going to inspect the hair and scalp. We will wear gloves for palpation. If lesion or infestation is suspected, it means that the patient has poor hygiene or is dehydrated. So, upon assessing our patient, I have not noted any infestation or dryness on their hair and their scalp. Now, we're going to perform once again hand hygiene to prevent from microorganisms from spreading and document the assessment. So that's all, Doc. Thank you.